Hello, everyone. My name is Sarah Pavelka, and I am a faculty member at the Iowa Healthcare Collaborative. I know at the bottom of your screen it says Katie Fadenhauer. I'm actually Sarah Pavelka, and I'm just on Katie's Zoom account. Happy to record this webinar for you today. So excited to share our information and what we can do through the Iowa Healthcare Collaborative and Compass PTN. So today we are going to talk about the information about data working for change and really putting the POP into your population, and how do we take a population of individuals and really make some sense of it through some data analytics. So what we're going to talk about today is how do I prioritize your population? How do you take an opportunity to organize your work for future trials of process improvement for those particular trials that you're working on? And then last but not least, we're going to cover some purposeful data. So having an opportunity to cover those three areas today. So let's get started and talk a little bit about population and how we use those populations of people for your projects as we're talking about process improvement. First of all, we want to think about and we want to remember your mission, your vision, and your values within your organization. Why is this important? Well, when we think about picking a group of people to help you with process improvement from a population standpoint, is we want to think about what's important to our organization. And that mission, the vision, and the values should drive this. We also want to think about a strategic balance. So in other words, we don't want to pick a particular project that involves studying a population and have it be just based on maybe finance. We want to really level that balance between service, quality, and of course, the money is important, but also the culture of your organization. How is that going to help your people within the organization? We also want to think about the problem statement of what we're trying to solve. So earlier in another presentation, I talked about picking a project and having a good problem statement. What are we really trying to fix? And so it's well defined, and that population of people that you're looking at studying should go along with that problem statement. And then last but not least, you have to remember that when we pick up a population of people, so a core group of people that we are going to study and see how well does their care change, or what do we, has this intervention helped them? You have to remember that there's a lot of things that relate to each other. It's not as simple as just saying, we're going to work with a population of people who have diabetes, and you can't forget about maybe some of their other social determinants of health. So we have to remember that there's opportunities for improvement in that way as well. So when I mentioned population a couple times, what do we mean by population? Well, population is a group of individuals that is often categorized or has a category of a larger group. So for example, we have maybe a whole state. Maybe you have a state population. Well, that would be your population. But it could also be a community or maybe even a county. So maybe it's a town. That could be considered a population. A population could also be a panel. Maybe it's a panel. We call these panel size in the clinic, but it could be your panel of patients. It could also be a group of people with a certain chronic disease. So maybe diabetes or heart failure. That could be considered a population. So it's everybody that comes into your clinic that has that certain chronic disease. That could be considered a population. So it's important to, again, define your population. So who are we going to work with on this particular, who's impacted by this particular work that we do, and then clearly be able to talk about where are the boundaries of this population. We also may not be able to study the entire population. So maybe a whole panel size is 3,000 people. Well, it wouldn't make sense that we look at the entire panel. So maybe we want to take a sample of that panel. And what we can do is we can select a certain group within a population or a sample. there's different ways to collect a sample, and there's different factors that we can, for selecting the population and really the sample. So are there certain characteristics? So for example, someone with diabetes over the age of 75. It could also be based on a personal location, or a certain location, I should say, or it could be a time period. So are individuals who came in with heart failure or diabetes that came in from January through June, or maybe that were seen in one particular clinic versus another, and those are considered samples. There's also different types of sampling techniques that you can, and we're going to talk about those in a little bit here at the end of the slide, but we want to think about that our sample should eliminate our bias, or not allow us to have an influence of the results. So when we talk about bias, we mean that we all have ideas on what the outcomes may be, and we want to pick both a population and a sample based on the fact that it helps us get true results and that our biases don't influence. So if you're thinking about process improvement and even picking a sample, you just want to be cautious of the fact that you may have bias. So for example, with that, you've got a population of diabetic individuals, or individuals that have diabetes. You've decided to select a sample of those over 65. You may want to go even farther, but be careful that you don't bias it by saying, oh, we're going to pick all those individuals that only come in to our clinic on a routine basis and that they have good follow through. That would be considered a sample of that is biased based on the fact that they have been following protocol. So there's some different sampling techniques and types. We've talked about using a non-probability, those that are not random with bias. So again, that would be, individuals with a certain diagnosis that is not so random. So we're going to pick 5 of our best patients, if we will, we can categorize them. So just be very careful with those. It's okay, but again, know that you're going into that sample with a bias. And those would be great for maybe a focus group. They may be great at saying they're going to give you honest feedback. And again, that could be completely true and be worth it. But when you really want to do true statistical analysis or do analysis, it doesn't even have to be statistical analysis, you want to think about trying to get it as random as possible. And so we have a particular population. We've decided to pull a sample from that population, and we want to think about doing it as random as possible. And so we want to think about, we can get a random sample on 3 different ways. The first one is a simple random, and think of that as like drawing names out of a hat. That would be completely random. So you put everybody in maybe an Excel spreadsheet and you just randomly pick the number of individuals that you want to work with. Then there is stratified, which would be a group. So maybe if you're going to have a strata of male and a strata of female, or maybe it's 55 to 65 and then 65 to 75. That would be considered a strata or a group within your sample, and then draw for the individual. So you know that you're pulling the same amount of people from that, maybe it's age or male and female, as you would from the other strata or the other group. And then the last way to get a random sample is just by doing it in a systematic manner. So maybe you put all your, say, diabetic patients in alphabetical order from your panel, and then you go every so often. So it's like every 3rd patient you're going to pull. And that would be a systematic random pull. So it's 3, 6, 9. You're pulling those patients that happen to land in that alphabetical order, and that would be a systematic random. So again, just some ways to think about pulling a sample from a population. We also want to think about organizing our work and using data for our future trials. So one of the first things that we want to think about when we have a future trial is starting off and creating a measure for that particular work. So what's a topic of priority, or what's a goal? And we want to think about picking a measure based on, is it safe? Is it effective? Maybe is it patient-centered, timely, efficient, equitable? So we want to think about selecting a measure that obviously relates to your priority, and that may be written in a SMART goal fashion, but also that the measure relates to one of those that are listed there. And then we're going to design the data collection system around that. So we don't necessarily want the easy way of collecting data to guide what we're looking at in our measurement. We really want to holistically think about, why are we measuring this? What's the topic, and what is it going to give us? And then design our data collection system. And I mentioned earlier, we want it to be balanced. This is a good way to think about when we collect and do our future measurements and our future trials. Is there a finance? Is there a satisfaction? Is there some sort of measure on people, quality, and delivery? And then last but not least, does it help us learn and grow? And so we have to think about that we want to be able to balance not only the work that we're looking at, but also our measurements. And then last but not least, we are going to have some sort of analysis or interpretation with these measurements. And so think about that ways that you're going to study and interpret it prior to actually getting the actual data in. What questions are you going to answer by looking at this data? And when you do get it, you want to look for patterns and trends. You know, was there a situation where it went up? And so really being able to answer some of those questions with the data. And there's tons of analysis techniques that the teams can do, your peers can do, and then also we can look for root cause. If you're interested in knowing more of this information, I'd be more than happy. I'm also going to have a longer presentation that you can dive in more into those future pieces. And our last section is looking at purposeful data. Data should, and the data collection should kind of run through some set of rigors prior to, so you think about your data. Was it, did it have good validity and reliability? So was it sensitive? So in other words, were there small changes and we could detect those with our data? Also, is it really specific or usable? So think about, you know, if you had to explain this to a board member, or maybe it's a physician group, could you really use it? And then last but not least, does it give you some idea of spread? So where did you come from? Did it actually help you improve? And then how are you going to handle that data once you have it? Are you going to look at it in order? Are you going to do some averaging? Are you looking for variability? Or are you just using it for comparative? All of these are right, but there's some statistical techniques that we can use in each of these categories. And we really want to think about how are we actually going to handle it once we have it? And then last but not least, we have our data, and we want to think about displaying it. We want to think about, what is the data trying to tell us? Who's the audience? And what is the intended information that we're trying to share by this data? In the end, your data should help you answer questions. And so again, you want to be able to answer these questions with your data. You just don't want to collect data to collect it, to say, yeah, we're doing it. You actually want to use it and get something out of it. So if you do have more questions, feel free to look at the longer video that's recorded out there. But before you do that, you run off, I want to say thank you and provide my contact information. Again, my name is Sarah Pavelka, faculty member for Iowa Healthcare Collaborative and Compass PTN. So excited that you could be with us here today. And if there's anything else you need, please reach out and let us know. So thank you, and I hope you have have a great afternoon.